So I'm thrilled to be joined now by Bobo. Don is the Corporate Vice President for Heart Valve Therapy at Edwards. Don, thanks so much for joining me.
Randy, my pleasure.
It's a fabulous meeting here that we've got going on, but let me ask you some general questions. What do you think is the state of mitral valve surgery now as we're here in 2013?
Yeah, Randy, that's an important question. When we think about mitral valve surgery, we really start with the patient. And part of what we get moved by is there's a significant number of patients that have the disease that don't get treated at all or in time. So as we think about the progress of this industry over the last 20, 30 years, it's remarkable that repair has become a standard of care. That a lot of physicians go to repair first. Replacement also gives you a great outcome, but we really look at the number of patients that get lost in the system and don't get treated, and we think that's important to influence over the next 5 to 10 years, both with interventions and with education to physicians.
I mean, I think it's a very, very important point. It is, you know, that's educating both the physicians. What about the consumer? What about the patient? Do they become a part of this equation?
Increasingly, and curiously, they're becoming an important part of it because it's important to them.
Right.
We've done little to do direct to consumers. It's a difficult thing to do with such a small number of patients compared to the big population, but we find increasingly patients are reaching out, patients' family are reaching out, they do searches on the internet, they look for the best outcomes, the products, and they oftentimes come to their physician with, hey, I found this, why aren't I being considered, or have you thought about this? And I think that's going to be influential going forward.
And that's, you know, it's an interesting deal because it's a difficult situation for a company, you know, to do, and you know, I think the physicians haven't played as active role with you all as partners in that. Let me get you to put on your futuristic hat. So think worldwide. Where are we going with mitral and tricuspid interventions and surgery in the future?
Tricuspid's a great place to start because we've seen 10, 15 years ago a valve that was largely forgotten, if I could use that word, become something that's routinely treated, and I think the data continues to show to the benefit of patients. And we've seen this globally. Japan is one of the highest adopters of tricuspid repair. The U.S. is robust. Europe is robust as well. And I think that trend's going to continue. We'll see more patients that get their mitral and tricuspid valve repaired together, which we think for a lot of these patients is the best answer. And for mitral therapies broadly, they're at one level, we're humbled by the complexity of the valve. It's a difficult valve to tackle with some of these less invasive or transcatheter products. It's a valve that's remarkably well served by surgery. And so I think over the next 10 or 15 years, you're going to continue to see those two trends come together. And I do believe there's going to be some very exciting interventions for the mitral valve patient and the tricuspid patient.
So similar, but a little bit different than the aortic story is playing out.
Similar in that there's a lot of patients that could benefit. Different in that it's a much more complex position. But what we've learned and what we've seen is with the collaboration between engineers, industry, and physicians, we've discovered and moved forward some remarkable therapies for these patients.
Yeah,
so
you really have.
It'll come.
It'll come. Okay, I'm gonna hold you to that. In my lifetime, it'll come. So, Don, let me ask you. You all have been great supporters of educational activities around the world. What about the Mitral Conclave? What are your thoughts about this?
We think this is hugely important for the physician community because the ability to get so many experts from different disciplines to come together and talk about a disease state holistically, we think is the best way to get physicians to move out and understand how to make this a bigger part of their practice. So compliments to the AATS, to the organizing committee, Dr. Adams. We think it's a very important meeting and maybe a venue that teaches us what the future should be in meetings. Focused on a disease, multi-specialty. I think that's here to stay.
That's a very, very good point. Listen, I appreciate all that you've done in the past for education and helping all of us to help take better care of the patients. Thanks very much.
Randy, thank you very much.
Good to see you.
Good to see you.
Thank you. Thank you.